Well, you look nervous. Is it the scars? You want to know how I got them? Come here. Hey. Look at me.
In this video, I'm going to talk about the biological basis of schizophrenia. Schizophrenia, which is a common long-term mental disorder that causes a large amount of distress and disability. Schizophrenia is the prototype of the category of mental illness called the psychotic disorders. Let me just write that. Psychosis. Psychosis. And psychosis refers to some specific abnormalities of cognition and often, characteristically, abnormal perceptions of reality. These may include hallucinations, which are sensory perceptions without actual stimuli, like hearing or seeing things that aren't actually there, or delusions, which are fixed false beliefs not explainable by a person's culture, like if someone has the idea that someone else is controlling their thoughts. The abnormalities of schizophrenia are often divided into three big categories. So let me just write 3 arrows here. The first of these are called cognitive symptoms. Cognitive. And there can be all sorts of cognitive symptoms with schizophrenia, such as abnormalities of attention, organization, or things like planning abilities. The second big category of abnormalities in schizophrenia are often called the negative symptoms. Negative. And these can include things like blunted emotions or a loss of enjoyment in activities. The third big category are often called positive symptoms. Positive symptoms. And these are typically the things that we refer to with this term psychosis, things like the hallucinations and delusions that are very characteristic of schizophrenia and the other psychotic disorders. But it really can produce these very complex syndromes spanning many different kind of mental functions, from the more thinking type of functions like the cognitive abnormalities, to the more emotional and motivational type functions like the negative symptoms, to the more perceptual abnormalities, these positive symptoms. Schizophrenia, either when their brains have been examined at autopsy after they've passed away, or with special scans that can look at the structures of the brain. But now there are newer kinds of scans that can actually look at the activity in different areas of the brain. And some studies that have been looking at these scans have also noticed in areas of the frontal and temporal lobes, in some of these same areas that the structural abnormalities have been seen, there appears to be a signal that there may be abnormal activity on the kinds of functional scans that we have currently. So a likely possibility is that in patients who develop schizophrenia, something happens abnormally during development of the brain, and that these particular areas of the brain do not develop normally, leading to the disease.
On the 27th of July, 1890, a gunshot was heard near the French village of Auvers-sur-Oise. It was the sound of suicide, the last desperate act of a sick man. His name was Vincent van Gogh. 2 days later, a life of struggle was finally at an end. When he died, Van Gogh was 37 years old and almost completely unknown. Only one of his paintings had ever been sold. He had experienced loneliness, persecution, and ultimately the madness that led to suicide. But his death also marked the beginning of his legend. Before long, it became obvious that Van Gogh had been an artist of genius. By the early 1900s, his paintings were recognized as masterpieces, and the story of his sad, earthly life became increasingly well known. The story of how he once cut off his own ear is now amongst the best-known tales of art history. But the life of Vincent van Gogh would not be so compelling were it not for the greatness of his art, all of it created in a handful of years prior to his death. His works are now amongst the best-known images of Western art.
Out that this is representing the organization of the cerebral cortex. Cerebral. And it's often different in the different areas of the cerebral cortex, how they're organized. So these are just a few examples of how the cells in the cortex may be organized. And what's been seen in some patients with schizophrenia is that the normal organization of these cortical layers, particularly in these areas of the frontal and temporal lobes that have been seen in some patients to be thinner and have less tissue, there's some disorganization or an abnormal kind of layering of the cells in some of those parts of the cerebral cortex. So these are some of the physical differences that have been seen in some patients with schizophrenia, either when their brains have been examined at autopsy after they've passed away, or with special scans that can look at the structures of the brain. But now there are newer kinds of scans that can actually look at the activity in different areas of the brain. And some studies that have been looking at these scans have also noticed in areas of the frontal and temporal lobes, in some of these same areas that the structural abnormalities have been seen, there appears to be a signal that there may be abnormal activity on the kinds of functional scans that we have currently. So a likely possibility is that in patients who develop schizophrenia, something happens abnormally during development of the brain, and that these particular areas of the brain do not develop normally, leading.
Of course, I'm an excellent driver. He lets me drive slow on the driveway. Of course, only 28 miles on the odometer since I drove it a week ago last Saturday. Should be more than 28 miles.
What is this? Who is this guy?
Raymond is your brother.
My brother? I don't have a brother.
Easycle connected them dry bones. Easycle connected them dry bones. Easycle connected them dry bones. Now hear the word of the Lord.
Of course, I'm an excellent driver.
You know how to drive?
Yeah.
Raymond! You never touch the steering wheel when I'm driving. Do you hear me?
Yeah.
Do you hear me?
Of course, I don't have my underwear.
What?
Them bones gonna walk around. Them bones gonna walk around. Them bones gonna walk around. Now hear the word of the Lord.
You're using Raymond. You're using me. You use everybody.
I'm using Raymond. Raymond, am I using you? Am I using you, Raymond?
Yeah.
Shut up! He is answering a question from a half hour ago.
Disconnect them bones, them dry bones. Disconnect them bones, them dry bones. Disconnect them bones, them dry bones. Now hear the word of the Lord.
Quite a trip, huh?
Yeah.
Uh-huh. What happened this past week?
Dance with Charlie Babbitt.
You want to learn how to dance?
Yeah.
Dance with your brother?
I don't know about you, but I'm starting to feel a little silly.
What else did you do?
Kiss Susanna.
Did you enjoy kissing a woman?
I don't know.
How was that?
Wet.
Wet?
Yeah.
Dustin Hoffman, Tom Cruise, in a Barry Levinson film.
I like having you for my brother.
I'm an excellent driver.
Now hear the word of the Lord.